Cathy Stoddart has worked in acute nursing since 1979 and currently is a staff nurse at Allegheny General Hospital in Pittsburgh, Pennsylvania. She serves on the executive board of her union, SEIU Healthcare Pennsylvania, an affiliate of the Service Employees International Union. And she is chair of the Nurse Alliance of SEIU Healthcare Policy and Politics Committee. SEIU represents more than 1 million healthcare workers across the United States, including 20,000 in Pennsylvania. Cathy, let's start with you. So many people probably don't think of healthcare workers when they think of OSHA, but in fact you do face dangers on your job. Maybe you can talk a little bit about some of the dangers that healthcare workers face, your personal experiences, and how OSHA has helped make things better over the years.
Well, certainly. You know, every day healthcare workers walk into a disease-infested workplace, and they do it on Christmas and the holidays. It's a scary place to go to work. It's also a very exciting and rewarding place to go to work. And, you know, in my career, since 1979, things have changed so much in the workplace as far as safety. Early in my career, a nurse was inadvertently stuck with a needle and contracted hepatitis. She converted that year and later died from complications of hepatitis. Healthcare workers, 17,000 of my colleagues in the 1980s died or contracted hepatitis in that time before bloodborne pathogens. And, you know, since OSHA has instituted safety regulations for bloodborne pathogens, that's fallen to nearly, you know, 97% of the healthcare workers go to work every day and don't even think about it. We have training and education. The department made sure that employers were required to offer vaccinations so that healthcare workers didn't have to even worry about hepatitis. So the changes have been completely dramatic. Today I go to work and none of my colleagues end up with hepatitis from inadvertent exposure to blood and body fluids. You know, one of the other things that I think has been so important in workplace safety for our healthcare workers is needle stick. Having safe needles in our hospitals and basically needleless systems where I don't have to use a needle for anything has changed not just nurses' lives, but imagine the environmental service worker or the laundry worker who had to find inadvertent needles in beds or in linen, in garbage. You know, there was a time when I worked where we carried our needles on a tray down the hall to a room, and you know, now in every single room there are needle boxes. We can get rid of syringes that might be contaminated. And I think back in the day, you know, there was a time when we didn't wear gloves. That was for surgery and very special, you know, cases of sterile dressing changes. Imagine that now. You know, and patients at the time, they said, our patients will be scared to death. And now they're scared to death if you don't have gloves on. You know, imagine the things that we just take for granted every day in healthcare. And I work at Allegheny General Hospital in Pittsburgh. I'm active in my union at the hospital. And my hospital does the right thing. We have a health and safety committee. It's called Life Safety. We walk around and, you know, much like the secretary said, the laws where let's find the things in your workplace that are unsafe and fix them now. That's what life safety is, and having a union and having that power and having an employer like mine who's so committed to having a safe hospital is so important. But safe needles and wearing gloves, those precautions have changed lives, have saved lives.
And David, we've heard mention of these standards, and they seem obvious in retrospect, very very common sense, but there were actually challenges getting them done, and sort of challenges that OSHA often faces when it tries to protect worker health and safety.
That's almost always the case. When we announce we're moving to a new standard, there are always employers, fortunately only some employers, who say, we can't make that change, it'll cost too much money, or it's not necessary. And every standard sort of really has that same history. You know, when we moved toward issuing a bloodborne pathogen standard to protect workers in hospitals and dental facilities, you know, the dentist said, you know, you're killing the tooth fairy, because they thought that we were requiring, for example, that you couldn't give teeth back to little kids, which was absolutely not true. And they said, you can't make us wear masks because it'll scare the kids off, or you can't make us wear gloves because we're not going to be able to do the procedure. And can you imagine now if that's the case? So we created a new normal.
And Cathy, in your workplace, what are some of the challenges that still remain, and some of the things that need to be done?
Well, certainly, Secretary Michaels alluded to ergonomics. You know, healthcare worker injuries from lifting patients is significant. It's still huge for our industry. So working, you know, collectively in that arena would definitely be important. Airborne precautions. You know, we think about H1N1 and the viruses to come. We really need to have some stronger standards on airborne pathogens and protections. And I think something that's up and coming, and I think it's very important, is workplace violence. You know, healthcare workers don't just work in hospitals. They work in nursing homes, they work in prisons, mental health institutions. They're going to be working out in the communities now. And I really think that, you know, a major focus on workplace violence, and, you know, people get mad when their families are sick. And, you know, we have a completely educated public, thank God. It's important. But observing patients' rights and figuring out what to do, and working with our unions together to fix that, I think those are very important things that I would look forward to having regulations on and working with the administration on. There's over 1 million healthcare workers in my union. We don't just advocate for ourselves in workplace safety, we advocate for our patients. That's what my button says. I'm an advocate for quality. The highest quality of care is what every mom and dad, every child deserves, and that means when they come in the hospital, they shouldn't have an infection when they leave. They should be able to come in, have the surgery, have the treatment that they need, and leave. And in that time, all the people who touch them, from the people who scrub the floors or wash the walls, should be as safe. So, you know, I think that having the voice on the job is so important, because I can stand up for you. I know what to say. I know where to look. So do other healthcare workers. Some aren't so fortunate. The you know, more than 1 million that don't have the union that I have. So I think that opportunity to be able to have a voice and have a say, and identify and be safe in it, not have to send a picture, but walk up to my hospital and say, let's work together on this, and they do. That feels good.
And how does that interaction work between the union and management?
It's an easy and comfortable interaction. You know, I say my management, but I think I speak for managements around the country, and I'm not management. But you know, I think they don't want people to be hurt on the job. They want patients to leave and be healthy. But if there isn't someone out there maybe holding their feet to the fire, or the regulations are calling the question, or even being educated, we have health and safety training. That's money well invested. People live because we do that. They're safe, and they leave hospitals without infections. So that's the difference. Working together with management to have training, having regulations that say you must have training on some very important issues like bloodborne pathogens, or you know, ergonomics. We practice that in our hospital. We have safe lift systems that every hospital should have. I think there should be a regulation that no new unit should be built without having an ergonomically safe way to move patients, because workplace injuries, back injuries especially, take experience. I have 30 years of experience in nursing, but it takes experienced healthcare workers away from patients who need them. It's not okay.
That's going to be our last question. Thanks so much, Cathy and Mike.